You've heard of Botox for the face, but how about the calves? This quick fix for your calves is simple and effective after only one visit. However,
So, Drew, how was this done?
We've talked about it before, and it is boot season, and boots are in, and women want to get their legs and look good in those boots. And we've talked about doing liposuction to thin your legs so you can fit the boots. Well, for some women, that's not the problem. For some women, it's actually the muscle itself, your calves, the gastrocnemius muscle is too large, and it's difficult to fit the boots. So doctors out there are using Botox, which we know cuts the response of the muscle to contract, blocks where the nerve comes in, paralyzes. You're actually paralyzing the muscle just like you're paralyzing the muscles in your face when you use Botox in this case.
So let's talk really quickly with board-certified plastic surgeon, Dr. Charles Lee. He's here. He's done this procedure. His patient, Sasha, has also had this procedure done. So first things first, Sasha, why did you decide to have this done, and are you pleased with the results?
I decided to have it done because I started to do a really high-intensity workout regimen, and I noticed that my calf muscle was getting large, especially from like the spin and swimming and all of that, and it just wasn't proportionate with the rest of the leg.
But Sasha, I mean, your legs are can you stand up and show us your calves? I mean, I can't believe that you ever had that large of calves.
I did. It was much larger.
Who's coming in and asking for this, and how often or how long have you been doing this procedure?
I've been doing this for about 10 years, and typically it'll be somebody that's got, as someone mentioned, large calf muscles, disproportionate to their
Now, see, the result they're showing there is more what I was thinking. This would be an excellent patient for. You have them stand on their toes, you differentiate, it's not fat.
But I have a question, though. So, Dr. Lee, you know, just so that we can also talk about the potential risks, we're not just talking about an aesthetic or cosmetic issue.
Sure.
You know, we all know there are deep veins in the legs, and you can develop a clot in the lower leg, and part of what keeps that circulation going is the contraction of your leg muscles. Any issue with that, or are there enough collateral muscles to help keep that blood flow?
Most of the overgrowth of the muscle is in the gastrocnemius muscle, which is the most superficial high muscle. So the injection's relatively superficial. We're not going deep into the muscles.
So how much does something like this cost? So someone comes in and they want their leg shrunk maybe 3 inches?
Atrophied.
Yeah.
Sure. It's a larger muscle, so of course we need to go in higher doses. Typically, we'll use a bottle on each side, so 100 units on each leg.
Use high dose.
And this is off-label, right?
This is an off-label use.
I mean, which is okay, but people need to be aware of that.
It's not, Botox is not approved
FDA
for
approved.
use.
So then this is around a $3,000 or $4,000 process then, if I'm calculating correctly.
It can be, yes.
So is it fair to say that you're using, in the literature, Botox is given to certain individuals who have spasticity, and it can relieve some of that spasticity, so you're using that same idea to shrink this calf muscle?